Mr. Chair, obviously the preeminent issue that the voters are concerned about right now is homelessness. And the governor just came out this morning with an incredible plan that I'm supportive of, with a lot of components. But we're all in our district struggling with this crisis. And we spent this last year looking at the Lanterman-Petra Short Act, which was a discussion we had when I was here last year on how it is doing these last 50 years. And the Lanterman-Petra Short Act said that institutions for mentally ill people were inhumane and we should close them. And so we closed them, and all these people went out into the streets, and then they went into the jails. So now our jails, at least in Orange County, my largest mental health institution is my county jail in downtown Santa Ana. But we've looked really closely at this act, and we should have a document out soon on what we've found. We also know that an audit has been requested through JLAC with the state auditor. We should probably be getting the results of Elaine Howell's work in April. But we're looking at what kind of solutions can we provide, because my constituents are real concerned about homelessness, and I know yours are too. And we've been looking at the mental health space. And with that, we've been looking at what is the best definition for gravely disabled. We've looked at other states, and maybe just for an example, and you have it in your staff report, Nevada says clear and present danger to self. And we've got to figure out, how do we help severely mentally ill people that are on the streets so they're not only a danger to themselves but a danger to others, because we're having individuals that are being concerned about who they bump into in grocery store parking lots. Or I just had a state employee I found out just yesterday was attacked at a local Starbucks by a homeless person who may have had some mental health issues. So with that, I've kind of come to the conclusion as a layperson, not as a medical professional, but realizing that maybe a 5150 72-hour hold isn't going to cut it for a lot of individuals. So with that, if some counties have the infrastructure that can provide for the services of individuals of this nature, they should be able to opt in. We did it with San Francisco recently with SB 1045 in 2018, and SB 40 just last year with a pilot for not only San Francisco but LA and San Diego. So why not, if there are other counties that are able to participate, we should give them the option. Orange County has been working very diligently on establishing a network to help mentally ill people. We just had Daryl Steinberg and Dr. Tom Insel in our county to dedicate a building in my district, which is 60,000 square feet, to help those with mental illness. So if they are willing to modify the definition, we should give them that opportunity, because we need to do something. I think this is an appropriate solution. The dilemma has been in the opposition, the main opposition, my concern has been the lack of facilities. So the Lanterman-Petra Short Act said we should close the mental health institutions and move them into community facilities, but 50 years later, we don't have community facilities. But we do have No Place Like Home, which we approved last year with Proposition 2. And so we are hopefully starting to build some facilities and structures. And even today's press release by the governor said, let's put another $750 million into start building and providing a place or paying for rent. We should also be working on the space of how do we provide more insurance reimbursements. The care homes, we're asking for $500 million, and Monday's LA Times, they're getting something hopefully in the governor's proposal for today and in his budget on the 10th. And we need to see what we can do with IMD waivers to try and get more funding down to those that are assisting these individuals, because we need to provide some kind of community facilities, but we need to start the momentum, colleagues, and achieve some successes in counties willing to step up to the current situation instead of just letting people die on our streets. LA County is losing 3 people a day on average that are homeless on the streets. So I bring this out of some kind of experience, Mr. Chair. When we had a schizophrenic homeless person killed in Fullerton by the name of Kelly Thomas, doctors and parents came to me and said, we should have adopted Laura's Law. So I worked with Senator Steinberg, and we did SB 585 in 2013. Got me up here a lot and had a lot of fun working on it. But it was approved by the legislature, signed by Governor Brown, and it provided a little bit of Mental Health Services Act funding, Prop 63, to fund for Laura's Law. So Orange County became the second county after Nevada County, and now we had 17 counties that have followed suit. Just had a recent study that said that this assisted outpatient treatment program is not only working well in those 19 counties, but why aren't the other 39 counties stepping up and doing the same thing? So we have some success. So that's why I'm in this space, Mr. Chair, because I think SB 640 provides a similar strategy. We wouldn't leave someone with Alzheimer's out on the street. But this bill says that if you are incapable of making informed decisions about or providing for the person's own basic personal needs for food, clothing, or shelter without significant supervision and assistance from another person, we should be housing you, and we should be diagnosing you, and we should be providing the appropriate medication, which is something that's been new in the last 50 years, where we can get you, get that person normalized and back into the mainstream society. We've got to get them on a program, and sometimes that takes longer than 72 hours. So a temporary involuntary hold is more beneficial than incarceration, which is what we're doing right now. So I've had a lot of fun, Mr. Chair, on this bill. I'm not a doctor, but I had fun meeting with Dr. Tom Insel, who has a wonderful national reputation, so we're very fortunate to have him here at the state. And I had the chance to meet with Dr. Jonathan Sharon, who's the mental health director in LA County, and just very impressive. Also been working with Dr. Drew Pinsky, who's also a psychiatrist, who's been very supportive. But untreated schizophrenia makes the condition more detrimental. If we don't treat these people, they actually degrade and get worse. So the sooner, the better. And therefore, I'm strongly encouraging, and I vote on Senate Bill 640 to assist those that we need to help on our streets, which is critical at this time in our state's history. Thank you, Mr. Chair.
Okay. Thank you. Before we begin with witnesses, I do see that we have a quorum, so I'm going to ask that the Secretary call the roll to establish a quorum.
Pan?
Here.
Pan here. Gonzalez? Here. Gonzalez here. Grove? Here. Grove here. Hurtado? Here. Hurtado here. Leyva? Here. Leyva here. Mitchell? Here. Mitchell here. Monning? Rubio?
We have a quorum. Okay, thank you. So witnesses support. Welcome.
Mr. Chairman, members, Josh Pane on behalf of myself and my family and my friends. My mom was schizophrenic for 59 years, was on and off the streets, and the system we have in place isn't working. I could tell you a variety of stories, but a great story is in the Chronicle on Saturday. This gentleman having real problems. Our system is ignoring them. He's on the streets. His sisters have tried to help, and they've gotten nowhere. What the senator is trying to do is provide counties with the flexibility to see these people that we walk by every day on the streets. The County of Sacramento has $24 million in its fund today, but the county doesn't have the jurisdiction to actually do something. That's the problem. So I would urge you to help this along right now, so that the next time we walk by one of these people on the street, we might be able to call somebody besides the police and get them some dire needed help. Mr. Chairman, I've spoken to you about this before. This is the first time I've spoken publicly, and so it's a little hard for me after 59 years of my mom suffering in and out of state hospitals. I'm not a big advocate of state hospitals, having seen them when I was 5 and 10 and 11 and 12 and 15 going to visit my mom. But there is a point in time where we have to do something about folks who need our help. And I'll leave you with this. just a brief from Senator Nick Petrus's oral biography. And it's just a small piece, and I could have a copy of this. It's a 400-page oral biography, but Senator Petrus, who I knew in the LPS, basically said upon reflection in 1989, so his law went into effect in 67, he and Lanterman and Short, and this is in 1989, he said, well, I tell you what I would say if someone left me on the street, basically is what he's saying. I'd say, damn it, don't I have a right to treatment? If I had broken my leg or had a heart attack, you would be swarming all over the place to help me. Doctors, nurses, this way and that way. So I just leave you with that. I'll make a copy of this. It's only about 30 pages. It's pretty interesting reading to see who the players were on both sides, who was against it, who was for it. They had total opposition as they were working their way through it. But I think it's interesting for all of you to read this, a little piece of history from Senator Petrus, who was a fabulous guy. He was the liberal, Lanterman was the libertarian, and Short was the senator who just wanted some community facilities. He thought that was the best thing that could possibly happen. So I'm happy to answer any questions, but I really applaud the senator's efforts, your efforts, Mr. Chairman, all your efforts, but now's the time to start moving this program along. Give the counties the flexibility with this type of language, then put $100 million instead of the $35 million that got deleted from the budget last year, put $100 million to the counties who are willing to go out and try to do something with these folks and help these folks with treatment, and then help those counties who are helping with cities working together and give them priority. When the city of Sacramento works with the county of Sacramento, they get priority for these funds to house these people. And it's not going to be a home like I live in. That isn't what my mom could do. She could do a bed. And so we need to provide that type of thinking. Senator Steinberg, the mayor, is doing that. So I'd urge you just to move this along for today and then keep working on all of these things. And give us all hope when I do my 5-mile walk every morning. Give us hope that I can call somebody but the chief of police and say, hey, come and help this woman. So thank you, Mr. Chairman.
Okay, thank you. Other witnesses in support? Back microphone. Name, organization, and assumes your position of support.
Good afternoon, Mr. Chairman and members. Larry Morris, on behalf of the California District Attorneys Association, in support of the bill.
Thank you.
My name is Mary Ann Bernard, and I speak as a lawyer, very familiar with superior commitment laws in other states, and as the mother of a severely mentally ill young adult on behalf of many other family members. We believe that SB 640 should be adopted statewide, as should Laura's Law.
So at the back microphone, it's name, organization, and position. So we heard testimony at the table.
All right, well, it needs to be amended because it forces parents to throw their children on the streets in order for them to be considered gravely disabled. It has happened to me personally. It has happened to many other parents. This is a problem. I know how to fix it. I have the language. I will be here and I will be outside this conference room when this hearing ends so that I can talk to people about that, and I will also email you, Dr. Pan.
Okay, and actually, if you have some language or some testimony you want to share with the committee, please present to the sergeants, and we will be happy to accept that. Thank you so very much.
Priscilla Quiros here on behalf of the City of Santa Monica in support.
Okay, thank you. All right, seeing no other witnesses in support, witnesses in opposition, please come up to the table.
I guess you could go back in the audience. Thank you, Josh.
Okay, and I assume you've coordinated your time? Okay. Of course. Thank you.
Good afternoon, Mr. Chair, members, Kurt Child, Disability Rights, California. Unfortunately, we continue to have an opposed position to this bill. The bill was essentially the bill that we had the opportunity to discuss and debate last year. And as we raised at that time, a number of our concerns, particularly, first of all, this definition itself, an entirely new definition that we would try to inject upon our LPS system in California, which we would suggest, such terms as incapable of making informed decisions and without significant supervision are all undefined terms throughout this statute that we would suggest that would really throw into disarray our LPS system throughout the state of California. It also provides the opportunity to look at history of treatment, which always is a matter of concern in looking at what may have been a person with behavioral health issues in the past being used to actually involuntarily confine them at the present time. So I think our major concern right now is, particularly as we're having, I think, some worthy conversations, as the Senator mentioned, as the governor's proposed now, some what appears to be significant resources to start looking at both housing and services for individuals. That's been our position all along on this, is let's not put the cart before the horse. Let's focus on making sure we got services in place for individuals before doing any tinkering with the statutory definition. I will just want to add, because this version of the bill now includes this option for counties to opt in and out, and that would put us in an extraordinarily different position than we have been throughout the entire course of LPS, where we've been striving to uniformity throughout the state. In application of LPS, you would have counties right next to each other, potentially employing different standards for determining whether a person should be involuntarily held. And again, that's what this is all about, is the civil rights. We think LPS has been, for the decades that we've had it, remarkably successful in continuing on the balance between the civil rights of individuals and the need to protect those individuals and others. And so, again, we would suggest that the conversation should happen in the context of resources available, as opposed to trying to sweep more people into a system that we know is at current time ill-equipped to handle them. So we would urge your no vote.
Good afternoon, Chair and committee members. Tyler Rindy with the County Behavioral Health Directors Association. Regretfully, we are opposed to SB 640. This bill would create additional confusion for who is appropriate for a conservatorship. It creates disparities across the state of who is eligible for a conservatorship, and then it provides no additional resources to county governments or providers to adequately treat an expanded population. A significant number of counties today do place individuals outside of their county into locked IMDs and boarding cares based on their treatment needs. And so you might have a situation where a county that has opted into this expanded definition would place an individual into a county that has not opted in. And so you might have someone walking on the streets who could be eligible for this under the expanded definition, while someone else is already being treated. So we see this as creating disparities and confusion of who would be eligible for conservatorship across the state. Additionally, the Joint Legislative Audit Committee did approve an audit of the LPS Act back in June of last year. That's set to be released in April of this year, and we're reluctant to support any changes to the LPS Act until we see any the findings from the audit and have time to review and assess the findings and recommendations from the state auditor. Conservatorship programs are currently seriously understaffed and underfunded today. And in a study by the Public Guardians Association, they're currently understaffed by about 20% across the state. And this bill does not provide any additional resources for an expanded population. We also view that the courts are the ones that make the ultimate decision of who is placed on a conservatorship, and this does not provide any clear guidance to the courts of who is appropriate for a conservatorship. And we do see across the state there are differences in who is conserved by the court's decisions. So, and there's the existing, it also does not provide clarification to the courts around how much treatment history can be included. There is an existing provision of the law that does allow history within the court decisions in a conservatorship case, but there's not guidance about how much history can be included. And we do see how that is an issue, but this bill is not seeking to solve that within the existing law. So, for these reasons, we are unfortunately opposed to SB 640. Thank you.
Okay, thank you. Other witnesses in opposition, name and organization and position.
Good afternoon, Jen Fleur on behalf of Western Center on Law and Poverty. We apologize for not getting an updated letter in, but we remain in opposition.
Thank you.
Mr. Chair, members, Alex Hawthorne with the California Hospital Association. We're in a oppose unless amended position. We have some concerns around the practical implementation of the bill and our ability to treat patients, which is our priority. If the bill moves forward today, we're committed to continuing that dialogue with the senator. We have some recommendations in our letter.
Okay, thank you.
My name's Allison Monroe. I'm from Oakland. I am against the recent amendments that seem to have watered down Mr. Moorlach's bill. I know Mr. Moorlach understands our problems. We are parents of the seriously mentally ill. I represent FASME in Alameda County, which is family members advocating for the seriously mentally ill. I have a daughter who is conserved right now, but I don't know that she won't end up homeless or in jail, like the great majority of the state's 10,000 sickest. And the way to decide who needs to be conserved is what is best for them to keep them alive and healthy.
Okay, ma'am.
The man on my shirt, he lives in Vacaville.
Ma'am, I assume you're opposed, right?
I'm sorry, I'm not familiar enough with your process.
Oh, so
I want whatever Mr. Moorlach wants to be done without the recent amendments I saw.
Okay.
Because I know his heart is in the right place. You have to know what's going on.
Okay.
These 10,000 are not going to come and testify here. They're locked up, they're in jail, they're homeless, they don't know they're ill for the most part. So the parents have to come and represent them, and I say to keep them alive. Conserve them if they need medical help, conserve them if they don't know they're sick, conserve them if they're in danger, conserve them. Thanks.
Thank you. Back microphone again, it's name, organization, I think, and also if you have material you wish to present, you can give that to the sergeants and that will get to the committee. So you can email it to the committee staff as well. We can arrange that. So thank you for coming to testify. Okay, any other witnesses? Seeing none, questions from committee members? Senator Grove.
Thank you. You know, I was reading an article, and we face homelessness in every county and city that is in the state of California. As a matter of fact, we invested almost $1 billion last cycle, and we're up 16% higher than any other state in the nation. On the streets of Los Angeles in 2018, 921 people died that were homeless. Average of 3 a day is what they're saying is happening now, compared to 298 in New York. In the first 6 months of 2019, 525 people died on the streets. We have the statistics of who they are based on the coroner's office, by race, by age, and a lot of the, other than the obvious ones that are broken down by number, by death by violence, stab wounds, things like that that they list. There's emotional disorders. There's a lot of information in this article that I was reading that talks about mental health issues and their inability to cope on the street. And when I served in the Assembly, along with my colleague from Los Angeles, and we were on Budget Sub 1, we listened to testimony after testimony after testimony of the cruelty that went on in these state institutions. Dummy slip and slide, actual murders, people being thrown out of windows, just all kinds of stuff that was happening in the disability community in the state services. And so the previous administration had legislation that went through, and it actually had closure dates. One of those facilities is in your district. Never in a million years did I think closing down those abuse-riddled institutions would end up with a majority of those people being on the street. not being able to take care of themselves, not being able to feed themselves. We encounter people even in Bakersfield, and I'm not a doctor, but obviously when you walk up with somebody and they're in a wheelchair and they're completely almost emancipated, they haven't eaten in days, they can't talk, they have no awareness of who they are, what they're doing. It's just cruel to leave them out on the street. You encounter other individuals on the street that obviously are talking to people that are not there, engaging in traffic situations where they could get run over by a car, stopping traffic, cars are just dodging them, and they're out there talking and yelling to people that aren't there. Well, and they're on the streets. And it's just sad that we as a society allow that to happen. And, we talk about deaths, like I said, 921 people in Los Angeles alone in 2018. So to all the parents, the thousands of parents out there that have to deal with children that are disabled, mentally incapacitated, and you can't do anything about it. You just have to let your kid live on the street or in jail. I think altering language, the witness that was here from Disability Rights, you said, there's currently counties are ill-equipped to handle this. Well, counties and cities are ill-equipped to handle the homeless on the streets. And there has to be solutions. We can't continue to have homelessness increase and not do anything for solutions. We can't just throw money at it. We do housing first, which everybody thought that was a great idea, but you put people in housing and they're still addicted to drugs and they have their mental health issues and there's no wraparound services. And so you create an unsafe environment for other people that are trying to get housing. So there needs to be some boundaries, but and I am all about a person's individual rights and them to be able to choose what is the best for them, but all of that has to come with the capability of them making that choice for themselves. And so I thank the author for bringing this bill. I thank the chair for working with him over a 2-year period to discuss some of the issues that are coming up. But just to say that the counties are ill-equipped to deal with this, the counties are ill-equipped to deal with the homeless population that's going on. So this giving them an opportunity to pick up the phone and call someone other. We had a woman that was on the street the other day, and I called the Women's Domestic Violence Center that my colleague in the Tulare County and the Kings County area toured with me, and they couldn't take her because she hadn't been sexually assaulted. She'd been brutalized and she was out of, not capable, and obviously, and like I said, I'm not a doctor, but it was very evident that this individual was not capable of being on the street taking care of herself. But they couldn't take her because she hadn't been sexually assaulted. So it's frustrating that there's no way to help these people, and if changing a small bit of language in a section of code will allow people to be able to be helped so that we can provide wraparound services and make sure that they have the stuff they need instead of just leaving them on the street to die, us being California and in 2020, I support the bill. So I'll move your bill, sir.
Okay, thank you. Senator Hurtado.
Thank you, Mr. Chair. So it seems that this bill needs a little bit more work. However, I read an article recently from an op-ed from a mother in my district, and I know that the homeless issue was brought up, but I'm thinking of this bill in a different way. I'm thinking, and I want to share a couple of lines that the mom shared about her experience. She wrote, he sat on the train track and he was praying when he died, and it was the hardest day of my life. Those are tears no parent ever wants to shed, and heartbreak no mother or father ever wants to feel. He was 24 years old. This happened about a year and 5 months ago. He battled with schizophrenia and substance abuse, and he had a home. He wasn't homeless. I think that we really just got to think and focus in on helping people, period. And I will be supporting your bill today to keep the conversation going. But as I mentioned earlier, it sounds like it needs
some work, but I'm doing it thinking of that mother and that child that she lost, because no one deserves to lose their child, and we need to work on making sure that this doesn't happen ever again. Thank you.
Senator Gonzalez. Do you want-
No.
There you go.
There I am. While I understand the spirit of this, I certainly do. I think all of us are dealing with this issue, coming from Los Angeles County, seeing the issue every day, talking about it every day ad nauseum, and also with good intention. I would say I also believe that the bill has a lot more work. And so I do agree with the committee analysis that we have an audit, that still is in the works to even figure out the definition of the LPS and how it's applied and the implementation. And so I think that in itself, I would be interested in understanding what that data and information look like first before we moved ahead. And also knowing that LA County has a housing conservatorship through SB 40, but people don't even know about it at this point. They have no idea what it even means. And so when you talk to LA County Mental Health as well, they're divided. Some folks believe gravely disabled means one thing, other folks believe gravely disabled means a completely different thing. And so I think we've got a lot of work to do, but I like to know that this can still remain an evolving bill. So at this time I won't support this, but I just wanted to ensure you knew that. But thank you.
Senator Mitchell.
Thank you. Since my colleague referenced me in her testimony, I wanted to provide a clarification from my perspective. In Sub 1, we were a number of years ago talking about the closure of developmental centers and the challenge with from some people's perspective, the delay in having a schedule was to make sure that everyone who was being removed from those centers was placed in a home. And so while there's been a number of reasons why we have had this really kind of slow burn, this uptick in terms of the number of homeless, it's not a result of the closure of those two recent developmental centers. The reason they took so long for the closure was to find an appropriate community placement. So I just wanted to provide that clarification. That may have been some of the work that took place before you got to the Senate, colleague. And so I didn't want to conflate those two issues. Do we have people in the street who shouldn't be? Without question. Did we, as a state, as a legislature, as an administration, not do what we should have done when the state mental health hospitals were closed 40 years ago? Absolutely. Must we do more in terms of board and care facilities and other supportive networks? Absolutely. But every individual that was displaced as a result of the closure of two developmental centers were placed in a facility. Thank you for the clarification. For the opportunity to clarify.
Thank you. So I do have a few questions, Senator Moorlach, and again, I appreciate why you're doing the bill, and I know that you had presented it before. I'd asked that we get some time to work on it. I know we have the opponents here, and I think they do raise some significant issues in terms of the. I don't think we're disagreeing on the problem. I don't think we're disagreeing about saying that, for example, people, we need people to get help and safe places. I guess my concern about the bill as it is that before us today, and we are the policy committee, is I was hoping there was going to be a lot more progress in terms of resolving some of the issues that were raised when the bill was first presented. So I guess my question to you, and then also since we have the opposition here, is that, and I know that some of my colleagues, we want to do something, and that's really good. I know you want to do something, and you've been involved in many other very important past efforts, is that since we first heard the bill last year to now, knowing that there's still going to be some time for the rest of the year to try to work out, where are we in trying to resolve some of these issues? We're hearing about, inconsistencies in definition, as lack of clarity. Resources is a little bit of a budget thing, so I'm not going to say that, well, because we didn't tie specific enough money into the bill itself, that isn't something we can work out there. And that's, by the way, that's appropriations. That's not us. We're policy committee. But I do feel that in terms of the act itself, the lack of, or different interpretations of definition, inconsistency. I realize that you, and this is a little tension here, that, you know, you're sort of like saying, well, because some counties may less be interested or not, that now we have this, you know, county choice, and that was sort of your way to try to accommodate some of the issues. Obviously not a solution I think some of the opponents like, because it creates disparities. But I guess, where are we in terms of conversations to try to resolve the differences since the last time we talked? Because in many ways, I don't see a lot of differences between this version when we last heard it, and I'm just concerned that we're the policy committee, we passed it out by saying, well, please continue working on it, but if we, in this period of time, we still haven't made that much progress in trying to resolve the differences, I'm concerned that we've had a lot of time to work on it, that we're not going to be getting there later. And I do feel responsibility as the chair of the policy committee, being sure that at least we can see an end in sight. We all know that that doesn't necessarily all come together in any bill, and that's not the standard I hold to this bill either, that we have to guarantee that we have a solution that we have in front of us. But you know, we also don't want it open-ended. That's why we're the policy committee. When we vote it out, we're sending a message saying that, you know, we are trying to push a certain policy forward. So perhaps you can speak to what has progressed since you initially presented the bill, and I'll also ask the opposition to perhaps talk about what they see as where do we think we're going to eventually land this thing, or do we have irreconcilable differences? So, Senator Moorlach, thank you.
Mr. Chair. The two focuses have been the language and the facilities. I've been more focused on the facilities. I think the issue of language is a weak argument, and so I haven't focused on that. We have 50 different states. We've analyzed their definition of gravely disabled. I apologize I didn't bring you the spreadsheet, but we had someone from the state library do a rather thorough review of what is gravely disabled, and then how is it working in that state. And the broader the definition, the lower the homelessness. So I didn't have a problem with arguing about the definition or arguing about the civil rights aspect, because I'm concerned about the civil rights of all constituents. We're dealing with a term, you know, learning new words here in the Senate, but and you probably correct me, but anosognosia. I mean, some people don't understand that they have mental illness. They think they're fine, and that isn't the case. And so I'm concerned about everyone else. Last week in LA, we had a homeless person go into a cafe, stabbed patron, died. I don't know if it was mental illness, but on the East Coast, we had a mentally ill person, schizophrenia, that walked into a rabbi's house with a machete and it stabbed 5 people. So we know that there are issues that need to be addressed, and I didn't even want to come here with that litany, Mr. Chair, of what we're concerned about, but I was more concerned about the infrastructure. This state has failed for 50 years to provide the community facilities for those that were released from mental health institutions. I want to thank Senator Mitchell for her clarification. We're closing a developmental center, which is different. But 50 years ago, we closed the state institutions, and they migrated, and now my central jail is the biggest mental health institution, and LA is the same. And so, you know, we failed. We said, let's do Lanterman Petrus and close the facilities, but we were supposed to open something else. So that's been the focus. And so we had No Place Like Home, it passed. But all of last year, we've been waiting for counties to submit grant applications. So that's been the process. And now, hopefully this year, they'll be approved and we'll start either acquiring existing facilities or building something. I know in Orange County, we have a land trust that was approved, or a housing trust that was approved by this legislature, a bill carried by Assemblyman Daley that I was a co-author of, and we're trying to locate 2,700 supportive housing units. And so the County of Orange has already located and started breaking ground on one mental health facility. It will be announcing soon a second and hopefully a third. So we're trying to do it, but at least it's a county that's trying to do something. But if we don't give professionals the right tools, then what's the purpose of spending so much money building things if you can't hold someone and actually treat them until they normalize? Because then they're going to look at us and say, why did you take so long? Why did you take so long to take me off the streets? Now, in Orange County, I've been amazed about how prevalent mental illness is. I have some wonderful constituents, bright, smart people, and they'll have a child that has bipolar or depression or schizophrenia. I had a good doctor friend of mine years ago said to me, I saw my daughter for the first time in 2 years. She was walking on Tustin Boulevard. Excuse me. She's better now, you know. But she's on a medication program, and you got to stay on the program, and that's what we're trying to do, is to get these people off the streets. And so that's been the focus, Mr. Chair, is that we've got to move forward on both initiatives: the ability to provide facilities, the ability to have some involuntary hold to help normalize these people. And so that's why I focused on that, because I'm concerned about all the civil rights. So when a constituent says, I don't like going to the grocery store because there's people in the parking lot that are scaring me, they're taking my car handles, they're doing things, you know, we've got civil rights for everybody to be concerned about. And that's why I made the focus, and I apologize for the wrong answer, long answer, excuse me.
So perhaps the opponents can also speak to where they
Thank you, Senator. Yes, we understand. I would want to point out that this, of course, is not the first bill that we've dealt with in the last few years on this very issue. And as you know, Senator Wiener had his legislation that essentially created within 3 counties, one of which is Los Angeles, and San Francisco, who is the only county, which is the only county now that's implementing that. And so that was, I think, a pretty hard-fought, crafted approach to test what may be an alternative to a definition for gravely disabled in the context of that. That has set up a pretty strictly confined test with significant evaluation criteria that after the period of 5 years that will give us a lot better understanding of what it is to just fiddle with a definition. What our major concern that we focus on is, again, as I mentioned earlier, that LPS is a whole array of processes that is used to determine whether an individual should be held due to a risk to themselves or others. And included in that is really crafting the rights that go along with that. And so to pick off one piece of LPS, which would be this definition, skews the entire approach, we would suggest, to how we make the determinations on whether the person is a risk to themselves or others. And if I can just add one other point that I think is really important, and I appreciate Senator Mitchell raising this, is that's really a fundamental distinction that we as a state made back when the Lanterman Act was created for the purposes of persons with developmental disabilities. We chose in California that those were was a more deserving population than those individuals who have behavioral health and mental health issues. For that population, we created an entire structure within the state of California California that assures every individual has a treatment plan, has regional service delivery. And it is a remarkable success to ultimately get to the point that we've closed the regional centers and moved individuals not into facilities but into communities. We never did that with behavioral health, and that needs to be, and I think part of this discussion as we're talking about now homelessness and additional resources.
Okay. And I do have, and then we'll get to you if you don't mind. So I just want to clarify though. So what I'm hearing from you, Senator Moorlach, is that because I think one of the concerns I have is about the definition, and I think you see in the analysis, the interpretation, and then we're going to have different variations and so forth, and I think I hope I certainly understand that you have someone who may. Well, it's challenging to evaluate someone and tell someone that, you know what, you need treatment, but you don't want it, but I actually know better than you, so you should get it, right? And we certainly, we can argue, say that someone who's in the throes of a mental health crisis may not necessarily be in the best judgment to decide what's best for them, but I think that's a very, that you'd be very tricky about, it's very tricky to do that, right? To go and say someone, so one issue for me is that this definition. Now, what I'm hearing from disability rights is that, we had a previous bill, is there a place, or is there going to be some place we can come to an agreement on a definition or is this some place where it's like, okay, no, I want a really broad one. I don't, so like, what kind of tests are we going to use to be sure that we're applying this definition appropriately and also consistently? Is that something where we can get to? I mean, in your discussions in the past several months, where has that gone in relation to this definition between, let's say, yourself and I think Disability Rights is the main organization who's raised concerns about that?
I can keep working on the definition. Who would you like me to negotiate?
Well, I think, right, I said, that's.
Negotiating with them. No, I'm just kidding.
So, I mean, I'm just trying to understand, like, I assume you've talked before about this, because this has been.
With Dr. Tom Insel, that's Governor Newsom's appointee to the mental health.
Well, I'm
happy to see what we can do, because the issue is I got people dying on the streets.
No, well, but the thing is, we also, we need, I think we need to try to come to a place where basically, the problem is that you have a definition that's used inconsistently or inappropriately, that's going to cause its own problems too. So, I get, so and that's what I was hoping that actually when we first heard the bill, that we would actually be much farther along in figuring out like a agreed upon approach to this population. So I don't know, have there been conversations between Disability Rights and your office about this?
We have not had any conversations, and we're a little surprised to see actually the amendment that actually went the wrong direction for us by giving the counties options on this. I think from our perspective, Senator, on that, which I tried to articulate, was that this is not an issue that gets resolved with just a definition. This is a broader issue, as you're perfectly aware, of services, of housing, and the availability, as my colleague mentioned, the resources that are available for public guardians to provide these services, which we now are wholly lacking out there. So tweaking a definition that just brings more people into a system that we think is ill-equipped to handle that is not the answer. It needs to be a comprehensive discussion. I would be hopeful that now, as the governor has put his proposals, at least as we've read for today, and some of this broader discussion, that there is a more comprehensive kind of discussion.
All right. Okay. Do you wish to also answer the original question?
Yeah, so I think from our perspective, we're happy to continue conversations. We're reluctant to support anything until the audit is released. We don't agree that this exact definition or the way of structuring it with a county opt-in program is the way to go. We also see and agree with Disability Rights California that there's a lot of things that are underneath the law of the resources, of the facility types, and the that needs a lot of work. The public guardians are seriously understaffed today and receive no state or federal funding. Board and cares, the reimbursement rates, which we place a lot of conservatees into, is wholly inadequate. They receive $35 a day to provide for room, board, and care. There's a Medicaid blackout on IMD facilities over the size of 16 beds, and we do have an opportunity as the state to apply for a federal IMD waiver this year, and we do appreciate Senator Moorlach's support on that. And so counties, we are very interested in that. But those are things that are underneath the law that are really beneficial to the entire system of our public mental health system in California. And we do see that our community-based full-service partnerships under the MHSA do reduce the amount of conservatorship that are utilized in, across the state. We have counties that overspend versus others on their FSP programs, and they actually do see a reduction in the utilization of conservatorship. But then at the same point, we get dinged by the state by overspending on the FSP programs versus others. So there's a lot of things. It's a very complex system that is occurring, and there's a lot of complexity that we don't see a simple definition change would solve the issues that we see at a society level. So, but we are happy to continue conversations.
Okay. All right. Yes, Senator Leyva.
Thank you, Mr. Chair. This is just, I think, something that plagues all of us, and it is something that not one bill is going to fix, and I agree that it's a societal issue. When people say, I think Senator Mitchell, when you went to Utah and did that to see how they handled their homelessness, and they have a 3% homelessness, I think it's different because I think what you brought back to us is that people in Utah look at someone who's on the street as their brother or their sister, and we don't do that here in California, and I would say in many other areas in this country. So how do we change people's perspective? I know when I look at someone on the street, I think by the grace of God, it's not me or my family. And mental illness is a huge issue. And you're right, we failed many, many years ago as a state. I would love to see you keep working on this bill because I know you think that language is a weak argument, but I have to disagree. I think that words matter, and if we don't get the wording right, we could actually be in a worse situation than we're in. I'll give you one example of wording that didn't get us where we wanted to be. A number of years ago, rape kits, the language was they should be tested, and we ended up being in a situation where rape kits have sat on shelves for years, and there's a huge backlog. There's a new law now that says rape kits shall be tested, so that will eliminate any future backlog. But I think words are incredibly important. So I would love to see you keep working on the bill. I also would like to see the study and see what they come up with before we start making decisions and we don't have all the facts. So I appreciate your work on it. I just can't support the bill in the form today, which is really hard because I know we have a problem, but I think we can do better. So I hope that if the bill does not get out of committee today, you'll keep working on it. And I also highly encourage you to talk to opposition, because I know when I have bills and there's opposition, I always meet with them because sometimes they actually have good ideas. So I thank you for being so concerned, though, and I'm just sorry I can't support the bill today.
Okay. Anything else? Okay. So the bill's been moved. Senator Moorlach, I know you've been working on this issue for a long time. I was hopeful that by the time we got here today that there would have been more progress. I am concerned, for example, the definition issue. I mean, it's not just words. This is a proposed law. It's a bill. It would be law if it passes through. And I appreciate that you're trying to address an issue that we all need to address. How do we be sure we help people who need help, right? Who may be on the streets and so forth. So I share that with you, and I want to try to come up with a solution. My concern is at this time is that to be fair to Senator Moorlach, I mean, I want to say to the opponents is that, because after all, I do also chair the Budget Subcommittee, I think it's a bit much to expect Senator Moorlach to write a bill to encompass all the things that have been brought up about the whole system, okay? Right? So I think now I think it needs to be addressed in some way, but it's not going to be the solution to every single piece. We all have written bills, and we know that, et cetera. So that, I think, is a bit of a burden. Obviously, we're the policy committee, so some of this would actually be appropriations. How much would it cost, et cetera? I mean, it doesn't need to touch on that, and I think that is a bit missing. So I appreciate you said you've been looking at the facility side, but also the side about, we're going to create a category, and we're going to put people in that category. And when people go into that category, basically, we're going to say government has certain powers over you, additional powers over you, right? And ostensibly for your, quote, your own good, I guess that's what this is, that's that would be the policy rationale or the reason. And then secondarily, and you pointed out, maybe it's also for the protection of the community as well. Although, again, I want to be careful we don't stigmatize people with mental health as necessarily being more dangerous than other people. I just want to be careful about that too. But we're going to create a category. It needs to be well defined, because otherwise then it goes to courts have different rulings, different administrators or bureaucrats are making different definitions, different board of supervisors, and then we'll have this whole hodgepodge. And I appreciate actually that you looked at all the different states and looked at all these different definitions and did that kind of background work. But I hope that actually that in doing that, that I think it shows the challenge of saying, well, we need to come up with something for California that's more well-defined, that courts and administrators and boards of counties and even the state itself can be more, can be sure that we're doing the right thing and that we're doing this consistently, because the answer isn't going to, I mean, there are variations in regions, but it's not like, well, if you happen to be in this county, you're treated this way and that's the right way. In that county, it's something very different, okay? So unfortunately, I am not able to support the bill today in this form because of that. But I do hope that we can continue to work. I know that you're going to keep working on it. I want to help you. If we can find a way to address that issue in a future piece of legislation, I just think it's too far away from where I'm hoping it would be. I encourage you to talk not only, of course, with Dr. Insel over the administration, but also with disability rights. We all have done bills. We may not get, the opposition may not necessarily be all on board, but at least we've tried to address, I think, important issues. And I think that's something I don't feel like there's been enough progress made for me to be able to support the bill today. So with that, would you like to close?
Thank you, Mr. Chair. Thank you for at least allowing me to use a little levity, as poor as it was, because this is an extremely serious subject. And, when you have constituents in your office and they inform you that they lost their son, and it's just something you want to work on. So, Mr. Chair, what we're doing now doesn't seem to be working. The Lanterman-Petra Short Act, to say that it's successful, I would just say go outside. Go to Skid Row in LA. Look at the data. It's not working. We have people, I've toured some incredible homeless shelters, San Antonio's Haven for Hope. And even there, they had to set up a courtyard so people could put up their tents. They refused to go into the buildings and sleep in the cots. Just had staff tour a facility in the Yolo Sutter area just last week. Same thing. Most of them, they didn't want to stay in the buildings. So we have people that we need to help. And you've seen Cal Matters do a rather exhaustive series of articles on mental health and where we should be going. And I think this this falls into where we should be going. I think the definition is fine, so I apologize for, I shouldn't apologize, but I respectfully disagree. I think the definition is fine, and we worked on it, and it's something that is optional. This is something that is optional, just like Laura's Law is optional. And so with that, Mr. Chair, people will still have psychotic episodes, and a 72-hour hold isn't going to cut it. And you're a physician, so you know what this is about. You know our emergency rooms can't handle these individuals, and they don't have the space to hold them for 3 or 4 or 5 days. So we've got to work in tandem to do everything, because this audit, which I support, and I'm looking forward to the results, but it's in April, and that's past the deadline to do something for this year. And we've got to be working together for this, this issue for the parents. I mean, these parents come in, the kids are over 18, they can't do anything anymore. Even HIPAA laws are preventing them from finding what the diagnosis is to even help their kids. And they can't file domestic violence orders, with the sheriff, because then they can't talk to their child for 2 years. I mean, it's just, everything is whacked. And yes, I can't do a bill that fixes everything in one shot. But if helping people with severe mental illness, getting the appropriate treatment, getting them off the streets, I think that's the humane thing to do. And that's why I think this bill is worth your vote. Thank you, Mr. Chair.